Thank you for joining us, everybody. We see the attendees. You're so welcome. So this is the fourth HERA webinar series, which we are thrilled to host today. This webinar series is put together by our early career researchers and different members of teams across the Public Spaces programme. This webinar series was set up to replace and adapt to the environment that we're in due to the global pandemic. And so we've been hosting these webinars as a place to meet, to dialogue, to discuss and explore the different issues that have been arising and research through the Public Spaces programme. So it's really apt that this is the midterm point of the programme, and we're absolutely thrilled to have the team here today. So yeah, the name of the webinar today is Exploring New Digital Worlds for and through field research in the challenge of this pandemic times. So it's going to be really interesting, the different changes to methodological issues. So we're thrilled to have everybody here. So I'm going to leave you and just welcome you again on behalf of HERA and the HERA board and network and our knowledge exchange fellows. So yeah, enjoy, and wishing everybody a very fruitful discussion today.
Thank you very much, Rosemary, and hello everybody, whoever is listening, and obviously hello to our panelists. Well, there are important, as a matter of fact, questions that will be addressed today, not necessarily answered definitely, but sure addressed. We do know that the COVID-19 restriction have deeply affected our lives. It's out of the question. That's something that already happened. However, also it affected the use of public space, and it forced us to rephrase. It forced us to readjust social activities. And in our cases, in the cases of the HERA project, I mean, obviously to readjust the field research as it was intended initially. So this webinar has the pretension, I would say, to present some of these methodological challenges, some of these responses that are creative, necessarily creative, and some of these readjustments that the different HERA projects have faced in order to be able to carry out alternative ways of conducting fieldwork, which is actually something that we have in common, all projects. We will explore them and share this question with you, and share also some possible answers emerging from this, from our empirical research. And some of these questions, not necessarily all these questions actually, are phrased as follows. How do we create the data during a pandemic? It's something new for most of us, or for all of us. How can the digital environment be considered as a tool, a research tool that actually works with us and for us instead of against us? And then how can we how can we manage to build trust, which is so important, and it's a basis for our research? How can we build it up with our partners and with the subjects of our inquiry? And finally, how can actually go beyond the problem issue and actually see also the pandemic, also these technological devices as opportunities? So as a matter of fact, there are a lot of questions that actually we'll try to address. Not necessarily will actually be finished with them, not necessarily they will be completed, but they will start addressing them. Okay, so I am Donatella Schmidt, and actually I am part of a HERA project, Food Together, Exploring Foodscapes. This project, just a minute, since everybody is going to present, I mean, at least 1 or 2 minutes will be devoted to present, I mean, the HERA project of reference. what I wanted to stress over here is that the project does have a theoretical dimension. Obviously, we talk about public space, foodscape, a very strong empirical dimension, and this slide is actually tells it about. So with the case studies from, 6 different countries that do see food, public space, migrants and refugees at the centers that are so declined differently in the different countries with different case studies, and also a practical approach, since actually we do organize pilot projects, 6 actually different pilot projects and 6 different hybrid forums that are actually forums that do see the collectivity as participants into the project. So that's about it. I like actually over here there is our logos, the HERA logos. Exploring foodscapes as public spaces for integration. And I give the floor to Giovanna Palutan as our first presentation. And thanks everybody for starting it up. Giovanna, to you.
Thank you, Donatella. And hi, everybody. I can share my screen now. Okay. Now it's a little bit slow. Do you hear me well? Yep.
Here it is.
Okay. Okay. Oh. Okay. No, only maybe it can work better in this way. Do you see?
Yeah.
Yeah. Okay. So hi everybody again. My name is Giovanna Palutan. I'm from the University of Padua, Italy. I am an anthropologist and a postdoc researcher within the Food Together HERA research project. And I'm very pleased to be here today. And we want to show our fields of research that the Italian team is carrying on in Italy. We have 5 fields located in 4 different settings throughout Italy. In Rome, in refugees, informal encampment, and in a soup kitchen run by the Jesuit for asylum seekers and refugees. We have here you can see the 2 places. And in Padua and Venice, we are looking at entrepreneurship activities tied to food started by Afghan refugees. And then we are working in Ventimiglia at the northern national border with dealing with the grassroots hospitality experience towards migrants in transit. We are a large group of people, 7 researchers, both senior and young. And our methodological approach is ethnographical, so based on participant observation. And all our case studies, 6, deal with hospitality practices tied to food in favor of refugees and migrants in transit that are carried on in the public spaces of our cities. We look at, as Donatella said, that food as a means of intercultural communication and relation as well between locals and migrants. But, okay, with the outbreak of the pandemic, things changed dramatically. COVID-19 impacted our country with extreme virulence. And we had a total national lockdown between March and May. And in autumn, with the second pandemic wave, the Italian regions had been classified, as you can see in the pictures, into different colored areas corresponding to different epidemiological scenarios, from context of maximum risk, the red zones, where people were required to stay home except for work, health, or other essential reason, to areas of lower risk, the orange and the yellow one. And moreover, locally have been taking severe containment measures that restricted freedom of movement. Just to say something to let you know our context, gatherings in public spaces, places were forbidden. Movements between municipalities as well as between regions were not allowed in the critical moments of the pandemic. We had closure of school, especially middle and high schools, and as well shops, restaurants, etc. Moreover, throughout the entire national territory, it is still now mandatory to respect basic prevention measures like physical distance and the use of a mask that we must wear not only in closed spaces accessible to the public, but also in all outdoor spaces. So this is the context. And as Donatella said, we had to rephrase our research. We encountered problems, but we faced also many opportunities. And our research, our methodology was based on participant observation, interviews, etc. And how we, which solution we found? We found multiple solutions because each context has its peculiarities. So we conduct a sort of fits and starts research work, depending on a scenario, on the scenario that was constantly changing and especially characterized by maximum uncertainty. And we also moved to digital platform following the impact of the pandemic in our research context through in-depth interviews with our Roman associate partners, for example. And then we opened a new venue of research in Padova that stemmed during the pandemic. And that was characterized by a sort of blended environment, online, offline, a research that was both digital and face-to-face. To resume to the questions raised in the webinar abstract. How are data created during a pandemic? This scenario of maximum uncertainty requires maximum flexibility since fields come and go. And we try to activate all possible pre-existing context. And in this case, the role of our associate partner was crucial. Second, how can digital environments be considered a tool? We see in this point pros and cons. From one hand, in fact, the digital devices open spaces of communication, but nevertheless, the events that depend on the technological devices are confined in time and space if the network of actors is not kept alive. The third question, how do we build trust? This is a crucial point for us, since we are doing research with people that are vulnerable, like refugees. So the question of trust is the basis of the research. How can we say about this? We managed first to open new venues of research thanks to our associate partner and to previous contacts that introduced us to new contacts. So we can talk of a sort of mediated trust. Nevertheless, if the research in the digital domain, if previous contacts in presence were not previously established, we couldn't manage to do research. So we have, because our research contexts are a kind of those accidental communities that Lisa Malki talk about. So people that are haphazardly thrown together. So the question of trust in presence is crucial and problematic if we have to communicate by a digital device. Coming to the last question. Okay, how face the pandemic restrictions in terms of problems and opportunities? We see many opportunities in this sense, that the digital means may enlarge the scope of inquiry thanks to the visual imaginaries. In fact, the digital means may include also people with basic linguistic skills by using visual communication tools. So in this sense, we were able to reach people that had difficult communication, low communication skills, and then through visual imaginaries provided by the web, they managed to create narratives and communication with us. Okay. That's all. Thank you.
Thanks, Giovanna, for your presentation. And probably we'll be having question and answer at the end of our presentation, so that actually we'll be more comfortable with that. So I'll give the floor to Javier. Javier, are you there with us? Are you all set? Yes.
Yeah, sure. I'm here.
Okay, good.
Okay. Thank you, Donatella. So I'm going to try to share my screen.
Here we are.
Yeah, perfect. Great. Okay. So I'm gonna begin. We've called this presentation. Well, first of all, thank you very much. I'm Xavier Villanueva. I am the assistant researcher of FEST-based project in Barcelona, and I am taking this role since January 2021. And well, yes, I would like to talk about how have we readapt our research in the light of COVID restrictions. As we study a FEST-based project, I'm going to give a brief summary of general FEST-based project. We study how festivals affect the use of public space with a focus on the interactions and with a focus on how this use of space can be inclusive or can be exclusive. The whole project is led by David McGillivray from the University of West of Scotland, and it includes 5 different cities: Glasgow, London, Dublin, Barcelona, and Gothenburg. Each project take the overarching questions and each city downs to his particular ground these overarching questions. I'm going to read the overarching questions to you. So there are 3 different questions. What different type of festive public space exists across Europe? And what lessons can we learn about inclusivity from these models? This would be the first one. The second question would be, how do festivals and events affect who uses outdoor and indoor public spaces and how they interact with them? And the last question, what are the enduring effects on inclusivity of festivals and events staged in public space? As I said, each team downs to earth these overarching questions to the particularities of the cities involved. What we've done in Barcelona is to back to we study, first of all, we study cultural events. And this is, each city has tried different events to study. For example, in Glasgow, they are more focused in sport events, or for example, in London, they have chosen 2 specific spaces, 2 parks, and they study every type of event happening in those particular parks. In Barcelona, we focus on cultural events. And we have framed our questions as following. What types of public urban space are constructed by cultural events in Barcelona? How is public space used, by whom, and with what kind of intensity? How is the city administration involved in these events, and what role does their policy agenda play? And does participation in these festivals or cultural events generate enduring tangible effects such as a sense of community and belonging, identity narratives, and networking between different actors involved? I also would like to, so this is how the project was before COVID arrived, and we had 2 different cases study, which we studied in depth. It was La Mercè. La Mercè is probably the biggest festivity in Barcelona. It's something we call Festa Major. It's a time where Barcelona citizens celebrate themselves, and it has like a really, really large programming, and it's programming induced for a week, 10 days. And then another festival, which is Sala Montjuïc, which is a culture industry festival related with the projection of particular films, and with a type of audience which comes basically from tourism and from citizens from different origin. I also would like to talk a wee bit about a particularity in the project in Barcelona. We had to begin 6 months later than the rest of the teams. And this is something which is related with the Spanish bureaucratic system of delivering the money and the funded money to begin the project. And I'm saying this because this is important in order to understand how COVID restrictions have affected our project, because we had to begin later, and then COVID got us in the middle, COVID restriction got us in the middle of our planning, and we had to reinvent ourselves, and we had to reinvent the whole project in order to be able to answer to the questions that are the base of our research. So regarding the types of public urban space that are constructed by cultural events, because we were not able to do the field work and to use methods as participant observation, for example, what we did was to work with geographers to build a database and a mapping with the spatial distribution of cultural events of Barcelona. Regarding who uses that public space and with what kind of intensity, what we've done was to cross the data from this spatial distribution of events with the communities that engage with these particular types of festivals. So we know with what intensity particular communities participate in particular events. Regarding the question of the city administration, what's their collaboration with these festivals? What is this participation? Again, participant observation was not possible. So we've developed, we've tried to answer this question by interviews with different agents involved in the Barcelona City Council administration, especially regarding ICUB. ICUB is the Institute of Culture of Barcelona and is the main body organizing and participation in cultural events in Barcelona. And regarding the last question about the enduring intangible effects and about the sense of community and identity narratives, networking between the different agents involved, we have. I'm going to talk about this a little with more extension later on, but we've changed our basic typology, which, if you see the two study cases which we began our study, La Mercè, which is a traditional popular Catalan culture festival, and Sala Montjuïc, which is a cultural industry festival, we have introduced another type of festivals in our typology, which are the festivals that the citizenship from Barcelona with different origins that are not Catalan or Spanish origins are bringing to the city. I'm going to talk about this a bit with more depth later on. What else? Okay, then COVID arrived. Of course, it has a big impact in cultural events in Barcelona. And because it had a really deep impact in cultural events, it also had a deep impact in our research about cultural events. Of course, I'm going to talk also about this a little bit later on, but of course the evolution of cultural events in Barcelona is not the same as it was in March 2020. For example, that events that we can see now. And I'm gonna let you know about that. The important thing here is for me to understand that we have not changed the questions. We have not changed what we want to answer. What we have changed is the methodology. So if we began with two study cases in depth, La Mercè and Sala Montjuïc, now after a rethinking of the case studies, after the developing of the database, we now have 12 case studies plus two aside cases, and we have a particular, we are very interested in understanding how COVID has affected also cultural events in Barcelona. I'd like to tell you a little bit about the calendar. As I was saying earlier, we had to begin 6 months late. We began actually in November 2019, but the project, all of the other 4 cities began in May 2019. What have we done in this particular time? Actually, it was done by the IP of our project, Alba Colombo. She conducted a survey with more than 300 answers in this particular festival, Sala Montjuïc, in the summer of 2019. We also had a previous introductory work with our stakeholders, and I'm thinking about the project, about the pre-COVID project, the Institute of Culture of Barcelona, ICUB, and Modiban. Modiban is the producer company of the festival Sala Montjuïc. We developed theoretical concepts like social cohesion, life festivity, etc., to better understand the job that we were going to do later on. And when the participant observation was going to begin, then COVID restrictions came. This is from March 2020, when we were locked down at home for 2 months. No possibility of cultural events happening in Barcelona, and no possibility of research. So this is the second lapse of time of our calendar. From March 2020, the restrictions are really great. Then and of course, cultural events are completely they stopped. They're not possible in Barcelona. The first cultural event to happen is a theater festival plus La Mercè, this Festa Major, this big festivity where Barcelona celebrates itself. And it happened in October 2020. But they happened with very strong restrictions. For example, pre-ticketing, all type of measures about social distancing, the use of face mask. You could only gather with people with groups of 4 people. And that has been the constant from October 2020 until a few weeks ago, where we had also by Christmas a curfew was introduced, so we had to be at home from 10 to 6. and all sort of nightlife was completely banned. That gave us a bit of uncertainty, and in order to construct our methodology, we didn't know if festivals and cultural events were going to be back earlier or not. And actually, we don't know right now if how are they going to be back, and how are they going to recover? Are we going to go back to our previous condition or not? What is going to happen? There is a big uncertainty of that. And because of that uncertainty, a big decision was taken by our team in Barcelona, which is to change the whole methodological approach to the research. But as I said earlier, to maintain the questions and to maintain the goal of the research, we want to answer the same things that we wanted to answer at the beginning of the project, but we have to be really creative methodologically, because it is impossible to use the participant observation that was framed at the beginning of the drawing of the project. First two creative methodological adaptations was the building of a database, of a really large database of Barcelona's cultural events. This database includes all Barcelona cultural events which are staged in public space and which have some sort of relationship with the Barcelona City Council and with its Institute of Culture, being that relation the organization of a festival, or being that relation the simple knowing that there is some people that are doing some festival somewhere. This massive database was built, and we are now constructing the mapping of this database, which is the crossing of all the data. So if we know which type of spaces were used in which particular time and with what particular type of audience, we're drawing a mapping with 3 different types of maps which are related also with all sorts of demographic and sociocultural information, which was also gathered in collaboration with different bodies of the Catalan administration. That was the 2 big creative methodological adaptations that were done in that particular timing. And of course, another activity we have accomplished are the participation in different conferences, explaining how we were readapting to this COVID break. And as a third big period of time, from January 2021 onwards, what have we done? The most important thing, as far as I can see, is that we have been able to build a cultural events typology of all cultural events happening in Barcelona. This was possible because we had the database and because we're building this mapping of cultural events. And the interesting thing to note here is that thanks to all this previous job, all this work that was not, how to say that, we were not thinking about that if COVID break would not have come, we have changed the typology of the events. We began the project with a typology which was divided in 2 types of cultural events. One of these big types would be cultural industry events, and the second type would be traditional and popular culture. Thanks to the typology and thanks to looking at database, we have realized that there are actually 3 different types of festivals that we could do this division. So we have in this now in this 3 side division, we have the cultural industry events, we have popular and traditional cultural events, but we also have created a new label, which is cultural diversity. And by that, we understand all of those cultural events which are not traditional from Barcelona, but which nowadays they are part of the landscape of events in Barcelona. And they are the cultural traditions of people from different origin, which is not Catalan origin. Barcelona is a big city, and it has grown up very diversity in a very diverse way. Its population is very diverse, and there's lots of people celebrating different types of festivities which are not traditionally Catalan. And we think that this has to be introduced in our typology of events hosted in Barcelona. So when this typology was built, we decided to select.
Javier, there, can you more or less conclude, because time is running?
Yeah. I'm going to be very quick. Can I have 2 minutes?
Okay.
Yeah. Okay. So these 12 study cases and of course the face-to-face seminars and conferences. And to be very brief, these creative methodological reactions to COVID has brought us what I summarize here in 3 different columns. The fieldwork has changed from a fieldwork based on observant participation. We have underway lots of interviews. We have also changed the way that we disseminate our surveys, which now have to be very hybrid, particularly by WhatsApp. It's working a lot with us, but they cannot be face-to-face surveys. We've done lots of archive research regarding to different methodologies used to study the Mercé case. We are doing lots of textual analysis, especially about a particular type of component of La Mercé festivity, the opening speeches. And we use also visual ethnography, which is also related with this archive research. Well, I'm not going to go very deep with this, but this is an example of the 4 cases that we have chosen from each type of event of cultural event happening in Barcelona. And I would like to finish with, because we have chosen these 12 cases, but we are still working with the cases of our pre-COVID scene. But the difference is that we're not using participant observation. From La Mercé, we're doing an archive research and content analysis of the opening speeches, which is a very, very relevant element of this festivity. And we were very surprised to see that the City Council had no idea of where this information was. We've gathered the information and we're working with that, with Atlas TI, basically coding them with categories taken from the overall project. And with Salah Montjuic, we did, Alba Colombo did a survey in 2019, and we're waiting, we're craving actually to be able to do this survey again in 2021 and to see how things have changed. So that's me saying goodbye. Thank you very much, and sorry if I talk too much.
Thank you, Javier, for your very interesting presentation. Plenty of questions probably are waiting for you and over there. And so I'll give actually the floor to our next speaker. I suppose it's Laura, and that is going to take the floor.
Thank you, Donatella. The next speaker is actually Marie, and I'm going to just share my screen. Yeah, can you see it?
Sure.
Okay.
Yes, thank you. Okay, so I'm Marie, my name is Marie Glaser. I'm a cultural anthropologist. I work at ETH Zurich at the Department of Architecture. So I work in an interdisciplinary context, and this brings me to my colleagues in the PUSH project. So we're working together. Laura is professor in Napoli. She's a planner, and we are working together with a bunch of more colleagues, Ellen Bray from University of Copenhagen, and Melissa, I forgot her last name. From Norway. I'm sorry, I forgot her last name. Okay, she's from University of Life Sciences in Oslo in Norway, also from the planning departure. Our colleagues in Copenhagen are from landscape architecture. So this is a cross-disciplinary project on public space in European social housing. Maybe we go to the next slide. So our PUSH project, we call it PUSH, stands for Public Space in European Social Housing. We work in 4 different countries, and we combine 5 case studies on large-scale housing estates from post-war time. So from the 1960s, you see, at least you get a glance, I mean, these very small pictures, but the idea is to look at these really large-scale housing estates, not as stereotyped social hotspots, but as public space. So we are interested in public space in these housing estates, but also consider housing as public space in the sense of spaces for interaction and coexistence joint action by very different residents and actors. And we chose in each country, we chose one project. In Switzerland, we had 2. And we look to these rental mass housing or cooperative housing estates to better understand how cultural encounters happen, and ultimately how maybe integration can be better sustained. So what can we learn from these housing estates where for a long time different people with different backgrounds mix and co-reside. We chose in the project 4 analytical categories called heritage, informality, democracy, and policies and practices. And we explore the publicness of spaces in these 5 housing estates according to these dimensions. And our theoretical layer, like our base layer, is understanding of public space as publicness, in a sense of publicness, not as a predefined like container space, like the green spaces or so, but as a social spatial configuration that can spark into being around common matters of concern. So publicness is spatial, but is also a social, it has a social dimension, and we look at the interplay of these things. How do we do? We planned our research strategy and approach, and each team in each country does it a bit different, but overall we are combined, of course. So we planned our methodological approach with a mixed methods approach and strong empirical orientation. That means we use fieldwork methods, empirical methods, interviews, mappings. In our case in Switzerland, it's photoethnography, a lot of workshops, etc., etc. And then we're going to do in-depth case studies. So we do the analysis of these cases and bring them together. We planned it as an iterative research process, and of course, go with the grounded theory approach. But as it is an interdisciplinary project in our collaboration, we have like methods from the humanities and also methods from architecture and from planning in our approach. So we are interested in the existing built and lived spaces, and we ask about the policies that have shaped them, and at the same time about people's everyday practices of responding or negotiating or practicing or counteracting these policies, and how they engage with their built environment, and how this comes into play when we look to the common spaces or the shared spaces there. And we planned to start our fieldwork in spring a year ago, and then Corona came, and with Corona, all the Corona measures that at the beginning we were quite shocked because we don't know what to do, because we had a lot of collaboration, workshops on site, going into the field with interviews and so on. So what happened? Maybe next slide. Can you, yeah. What happened? We, in the Swiss cases, and Laura is talking about her Italian research then in a minute. In the Swiss case, we had to come up with an idea how to reach out to the people, to the inhabitants and to the residents during Corona. And even we felt like we have to do, because yeah, it was a quite harsh time also for the families living in these big housing estates, sometimes not even having a balcony and so on. So we moved our fieldwork to manifold digital forms and also to kind of very old style communication forms. So instead of going there and doing an interview, a walking interview or so, we started an initiative. We put out flyers in every entrance of the houses. You can see the poster here, and ask them to connect with us via SMS, via WhatsApp, via telephone. So like a telephone hotline, or even with written letters or videos or whatever. Because especially for the elderly persons there, we were sure that, you know, with WhatsApp or with new digital forms of communication, we won't reach most of them. So we started this telephone hotline and also asked for letters. And we did receive written letters and telephone calls. So we tried to find a way to reach the, you know, the variety of groups in these very socially and culturally mixed estates. And we bought a prepaid mobile phone to give a number. We wrote snail mail, and we did telephone calls, and it worked out very well. Actually, interviews on the telephone was possible, also via Zoom. We switched that very quickly. And yeah, the only problem was not being there on site on our own. We couldn't travel really there. It was not allowed to go out. So maybe next slide. Yeah, here you can see where we posted the flyer in every entrance at the houses. People could really read them, and the management of the houses, they supported us immediately. They mounted it. We sent the material. So what we received were kind of WhatsApp news with pictures by residents, or even they recorded audio files from a construction site that was going on in the block during Corona, and wrote commentary on that on a regular basis. So we received several again and again, and they people send us material, private photo material from their own archives. So we started kind of a more participatory research, actually. So it made us quite creative, and we received a lot of material, very manifold material, and established good contacts with that possible key persons then for an interview via that call for whatever material you have. So we kind of really we reached the people there, and kept contact for, you know, going there now, maybe when it's a bit better. And next slide. So here you can see just, you know, I show you private pictures, archival material from persons, letters, emails, and so on. So actually what it brought to us was even more participatory methodology than we planned for that moment. And so we have kind of rich material now. When we considered the material, we found out that we had a lack of the perspective of children, youth and children. And so we came up with an idea that also our colleagues in Italy developed, and we started kind of a co-project with our Italian colleagues. And Laura is going to talk about that now.
Laura, you are with us?
Yes, I was not able to go back to the.
Laura,
yeah, okay.
I just like to mention, Laura, just 1 second. I'd like to mention that actually it's around already 12 minutes that you are talking, so you have to to keep a kind of short everything the presentation.
I don't think I can do it in 2 minutes. So
No,
if you
I am
guys are
sure about
patient
that.
and give me two more minutes,
No,
because
no,
I'm
sure,
sharing my
sure,
time.
sure. I
Okay.
just want to mention, just, okay.
Okay. So can you see the screen? We've been working in Lotto O, which is a public housing estate in the eastern periphery of Napoli. This place is a concentration of low-income tenants and urban poor with high levels of unemployment and school dropouts, illegal squatting, and crime-related issues. And yet, forms of publicness arise to creatively resist the entropic pole of distrust and segregation of this place, mostly driven by informal practices of self-provision and community building. So during the first lockdown in March, things got really critical in the neighborhood. Many people lost their job, mostly those employed in the informal sector. Food emergency became an issue, and the overcrowding of apartments where often different family generations live together made it difficult for many children to attend online classes. So as a group of researchers that usually invest much time in vis-a-vis interactions with people in the neighborhood, we had to come up with new ideas to stay connected and to keep the ties of trust and recognition with the community that we've been building up since the project started. And one project that came up in this context was this joint project with Swiss team and the Italian team. It's with Telly and Lotto O, school children, and here children assisted by their teachers and a couple of researchers of the team have learned how to write a letter to a long distance friend in English, which is not to be taken for granted for children living in a segregated neighborhood like ours, and how to keep long distance relationships and feel to be part of a broader community. The interesting thing in terms of how we are learning from COVID-19 emergency is that from this lockdown joint project, other activities originated. And one is the Shelter Atlas, in Lotto O, which is an ongoing online project aimed at developing the digital skills of children to represent with different media their home space. And the Atlas is a way to explore the children's feelings and perceptions by focusing on daily objects. That means something to them. These are some examples of this kind of online exercise and community building that we are doing. The other project which came about is a project about places in Telly, aimed at understanding feelings and perceptions of school children about public space in the neighborhood, which is based on different forms of representation of places. And here are some images from this ongoing project. And this is another activity that we are developing since the COVID-19 emergency started. I give the floor to Marie just to comment a little bit about this project.
Just very shortly. So this is a project that, where we reached out with a theater, an alternative theater in the city of Bern, and they worked in the neighborhood, and the project actually worked there for 3 months together with us, filming with kids about what the Janagut or what this complex means to them, the spaces, how they appreciate them, what they would like to change, what they dream of, and so their perspective. This video catches the children's perspectives together with a filmmaker and the teacher of the school. And it will be soon also, I think, online, and we include it in our exhibition material. That was a very productive, spontaneous, collaborative way of engaging there in the neighborhood.
To conclude, the social spatial repercussions of COVID-19 emergency in Napoli, Lotto O, have emphasized the role played by networks of mutualism and solidarity, both in physical and digital terms. And the emergency and the lack of support from formal institutions has led to the rapid spread of crowdsourcing platforms aimed at mutual help and support, and the production of a new sense of place through digital storytelling and interactions. These practices, mostly triggered by local NGOs that we're working with, are often facilitated by the use of open source mapping tools that allow to measure the diffusion and impacts of mutualism and solidarity. And here you see some samples of a mapping project originated during the first lockdown to trace solidarity networks in the eastern periphery of Napoli. And the emergence of these practices in vulnerable contexts calls into questions the social spatial geographies of proximity and brings out a hybrid, adaptive, and complex urban ecosystem through which relationships between actors and places are constantly reframed. The rise of a digital publicness is one of the striking results of our long distance empirical investigation with vulnerable communities. And in a context where formal institutions hardly cope with social inequalities made even worse by the current pandemic, we are somehow, as researchers and community advocates, we are part of an ongoing experiment of a hybrid community seeking for recognition, support, and respect by resorting to means and media never used before for such purposes. Thank you so much for your attention.
Oh, well, thank you really very much, Laura and Marie, for this presentation. It seems that the project is actually extremely interesting, and we'll hope to have the chance actually to share views in the next possible event in presence that probably we'll be having with HERA. That's definitely very interesting. I mean, introducing concept of mutualism, solidarities, and the concept of community advocates that basically a lot of researchers probably share. So, well, next presentation will be, I suppose, our James, that is all set to speak over there. James, to you, the floor.
Thank you very much, Donatella. Let me just share my screen. Play from start. Okay, can you all see that nice and large in the large version? Not the notes version.
Yeah, we can see
Okay,
it.
Brilliant, thank you. And yeah, thanks so much to Marina, Rosemary, Joe, and Tony for facilitating the session. It's great to be here, a little bit like Eurovision. Firstly, a little bit of context and project background. This brief presentation emerges from the HERA funded research, obviously HERA funded research project, Intoxicating Spaces. This is a comparative study of the impact of new intoxicants on 4 European port cities between 1600 and 1850. So very much a historical project, unlike the others presenting here today, with special reference to the impact of these novel substances on global networks and urban spaces. And by new intoxicants, we mean chocolate, coffee, opium, sugar, tea, and tobacco, sometimes referred to as soft drugs. And our 4 case study cities are Amsterdam, Hamburg, London, and Stockholm. And you can find out loads more on our website at intoxicatingspaces.org. Now, alongside a wide range of traditional and public engagement outputs, which I won't be talking about all of them today for reasons of time, but the flagship digital output of the project is a virtual exhibition designed in conjunction with colleagues at the Digital Humanities Institute here in Sheffield, and conceived as a sort of digital scrapbook. This online resource will bring together a wide range of documentary, visual, and material sources relating to new intoxicants in each of our 4 cities. And the concept of the virtual scrapbook was very much inspired by the scrapbooking and collaging cultures of the 18th century, an example of which you can see here. Now, in terms of the pandemic and its resulting lockdowns, we've been quite fortunate in that this was always conceived at the outset as a virtual exhibition. There was never supposed to be a bricks and mortar equivalent that would, of course, have had to be cancelled. Moreover, the resource was always intended primarily to bring together and add value to sources that were already online in some form or another, a process of creative recombination, in the words of our project leader, meaning that its development and population with material has not been affected too adversely by the closure of libraries, museums, and archives necessitated by COVID-19. And for a historian, this is our sort of field observation, our field work. It's in these cultural heritage institutions that contain significant bodies of historical material. And here's just an example of the already digitized material that we've been sort of working through and will be federating within the exhibition. This is an 18th century engraving by William Hogarth from the Wellcome collection, a resource that we've been working with extensively, and it depicts Tom King's coffee house in Covent Garden, which you can see on the right-hand side here. There's a little sign, Tom King's coffee house. And you can see a fight is going on inside, rapiers have been drawn, and a wig has been thrown out of the window. It was a notoriously turbulent establishment, and in many accounts actually doubled as a brothel. So this is an example of a sort of visual source, but that said, the exhibition will also comprise a large number of archival sources that we managed to identify and photograph during the first 6 months of the project, and during very brief gaps or hiatuses between lockdowns. And here's a lovely entry from the 17th century diary that's in the British Library in London, which I photographed literally just before the first UK lockdown came into force in mid-March 2020. It's from the diary of a chap called Thomas Rugg, and here he describes new intoxicants on the streets of London. I'll just quote from here. And there was also at this time a Turkish drink to be sold almost in every street called coffee, and another kind of drink called tea, and also a drink called chocolate, which was a very hearty drink. So how does this process of digital scrapbooking, as we call it, work in practice? And how have the Intoxicating Spaces team been adding value to the textual, material, and visual sources we've all been busy gathering throughout this extremely trying period? So basically, to collect and manage material, a bespoke and sophisticated data collection interface has been developed for us, a back end, to use software development jargon. And this powerful tool allows us to do a number of things. We can upload images of manuscripts, images and objects. Here's the coffee house images that I've just mentioned. We can link to the originating source and all relevant credit and licensing details, obviously extremely important when you're using material from already digitized material from a wide range of cultural heritage partners. Significantly, we can add transcriptions and descriptions of the objects. Significantly, from the perspective of the project, we can add latitude and longitude information to each scrap for the purposes of mapping, and to add, and we can also add a whole variety of thematic tags using controlled vocabularies. And these are sort of listed down the side, so we can identify obviously the city, the country, the source type, the particular intoxicants that are involved, particular themes, objects, and the genders, nationalities, and occupations of who's actually consuming, retailing, or trafficking the intoxicant within each scrap, and also information about the setting, the room, the day of the week, and the time of day. So there are all of these layers of adding analytical value, if you like, and sort of recontextualizing and repurposing sources for the specific intellectual and public engagement purposes of the project. And for sort of overall orientation, the resource allows us to gain a helicopter view, if you like, of all of the scraps that we've collected, which number about sort of 600 at the moment, with sort of numerical hierarchies for each of these typologies. So we can see the top intoxicants, the top themes, and so on. However, We're quite excited about it, but of course all of this admin will remain very much behind the scenes. Scraps will be presented to the end user via what we hope is a sort of beautiful public interface that will combine scrap, map, timeline and story views. That we basically want to provide as many ways into this sort of rich body of material as we can. Now, the prototype of the front end, so to speak, is still very much in its early stages. And we don't yet have the map, timeline or stories fully implemented, but we do have what we call the sort of the scrap view in place. And here the user will be immersed straight away, basically, into the richness of the collection, which can be sort of sifted, sorted and recombined using these intuitive visual facets on the left-hand side, each one of which is equipped with a pie chart. So say, for example, if you're interested in coffee in Stockholm, you'll be able to very easily home in on scraps relating to that. And having this sort of interactivity was very important to us as a team. I think on a whole, at our early meetings, we found many existing online exhibitions, while beautiful, to be a little bit static. They almost recreate online the fixed and predetermined structure of a physical exhibition. And we wanted to take fuller advantages of the affordances of digital for presenting and exploring information in a slightly more dynamic way. And obviously sort of clicking on each scrap will take you to the full record or exhibit. And here's how the little sort of coffee house I mentioned earlier sort of looks in the front end. Here's the image, source and licensing information below. All of our sort of thematic tags arranged by type at the top, little description, and of course in its position on the map. And of course, once we have the map views fully implemented for all of those scraps where we have latitude and longitude information, they'll be able to explore collectively through a map, which we think will be quite exciting. So yeah, obviously in terms of the pandemic, it's quite interesting. We've pivoted a little bit more to the use of digital material, but that was always, as I mentioned, going to be the core of the exhibition. So in that sense, this output hasn't been too severely affected by pandemic times. And on that note, I think I'm going to leave things. Thank you very much.
Well, thank you really, James, for your, very rich presentation. I suppose that we'll have a chance to actually go back to your project. I definitely am not able to activate my video anymore. Okay, so right now I have the audio that's actually working, but not the video. Okay, in any event, no, Monica, the floor to you. You are with us, so please share your presentation with us.
Thank you very much. Do you hear me? Can you see me?
Sure.
Okay, my camera also had some problems before. Oh, no, it's just going down without me doing anything. Okay, so you had really excellent presentations. I don't know what is happening here with my presentation. Look, it's going just by itself. But 2 years ago, no one could have imagined that qualitative research and face-to-face interviews in particular would be something dangerous that was not recommended or even banned for more than a year. COVID-19 not only disrupted on our daily routines and dramatically intervened in our lives, but also became a major turning point for methodological questioning of the way why we do fieldwork. Today, I will present the challenges, dilemmas, and possible solutions for fieldwork in health settings and with some vulnerable groups. So this clicking is not done by me. I don't know what is happening with my PowerPoint, but I have a finger on it and I will stick to the picture that I want to show you at the time. So to begin, a few words about our HERA project. The team of 11 researchers from Germany, Slovenia, Croatia, and Poland, mostly from medical and humanities faculties, has joined forces in a project entitled Healthcare as a Public Space. Our project focuses on diversity in the general social context of healthcare, viewed as a public space, as well as in the specific context of medical institutions. The aim of this project is to generate systematic and in-depth knowledge about how and to what degree the European norms and guidelines concerning diversity are implemented in national legal regulations in Germany, Poland, Slovenia, and Croatia, and how they are realized in clinical practice in these countries. So far, we had successfully completed the first 3 phases of the project, reviewing European and national legislation on access to healthcare for vulnerable groups, as well as clinical and ethical guidelines in all 4 countries. We had concentrated on 3 features of diversity, gender identity and sexual orientation, race and ethnicity, and religion and belief. So we found out that generally European Union legal system prohibits discrimination on grounds of religion or belief, racial or ethnic origin, gender, and sexual orientation. However, European Union secondary law provides protection against discrimination only on the grounds of racial or ethnic origin and sex. The issue of discrimination in healthcare on the grounds of religion or belief, gender identity, and sexual orientation is not specifically addressed under European Union secondary law. Reluctance of some member states to adopt comprehensive anti-discrimination regulations leads to a situation in which protection in access to healthcare primarily depends on national regulation. So ahead of us now is the final phase in which we plan to conduct interviews with healthcare professionals and selected vulnerable groups. Because of the pandemic, we have had to adjust our approach and expectations a bit and focus more on e-research. So healthcare, understood as a medical space, is an excellent example of a public space that models the processes of social integration and social justice. However, depending on its organization, it can also influence the societal segregation of minority groups. When we talk about space in the broadest sense, this can take the form of looking at the physical spaces in which healthcare takes place, or the contexts of public and private discourses about health and illness. It can take form of thinking about how medical humanities opens up a critical understanding of space, its metaphors, configurations, and geographies. Exploring various barriers to access to healthcare for certain vulnerable groups in the pre-coronavirus pandemic era of 2020 is even more limited now because healthcare facilities have become public in a different way, with a set of safeguards that limit access to many healthcare services for all people. Access to public health facilities is tightly controlled today. So just a quick reminder how healthcare institutions changed in less than a year into closed and monitored institutions. I will give you our example, Slovenian example, but you can translate it to your national health system. So last year in March 12th, Slovenia declared the coronavirus outbreak an epidemic. Numerous measures have been put in place in order to slow down public life and prevent the spread of infection. The temporary measures in health services due to the need for containment and control of COVID-19 epidemic were to put an immediate hold on all preventative measures and programs, put a hold on all outpatient visits and appointments, with exceptions of those marked as urgent or very urgent, oncological services of all types, and monitoring of pregnancy and delivery, and put on hold on all dental services. The exceptions were emergencies that were life-threatening. These were managed in the so-called white areas of hospitals, as opposed to red areas or gray areas, which were more dangerous. In April last year, other services that were exempted from what I just mentioned were allowed, such as all procedures, if not provided, could cause a significant worsening of the person's health condition, then essential prior medical checkups before employment, health services for firemen and active service. Healthy pregnant women had less examinations during the pregnancy compared to the normal times, and husbands or partners were not allowed to be present at childbirth. These measures applied for the duration of the epidemic. From the end of April last year, women in labor could be accompanied by their partners during delivery if they both tested negative and if they both were wearing appropriate PPE. So since May last year, all planned types of services could be performed again. There has been a widespread impact of the COVID-19 epidemic on the delivery of healthcare services. Data from the previous year show the number of GPs consultations decreased by more than 30%, and the number of hospital discharges decreased. The impact on the outpatient specialist services varied by specialty. There was no chance in service uptake in oncology, dialysis, or emergency cardiology. However, the number of planned elective interventions in orthopedics saw a reduction of more than 40%. So there were also breaks in cancer screenings, uptakes, but all cancer screening programs have successfully resumed after a time. The checkups for chronic patients had been on hold since the declaration of epidemic, mostly due to the fact that nurses running them were deployed to COVID departments. Today, 1 year later, 72% of family doctors in Slovenia are totally burned out. There is no data for specialists in hospitals, but despite all the stresses and also the increased violence of COVID skeptics and COVID conspirators, the figure is probably similar. The medical staff is overworked due to the high number of patients and hardly have enough rest and sleep. This has taken a toll on their health and well-being. Additionally, it must have taken a toll on their emotional health to watch their patients die daily. I have to mention also that for several months since November till February, Slovenia had been the country on the third place by the number of dead people because of COVID. So that's why I'm showing you this picture so much. So I could go with this reporting what happened during COVID more and more, but you know the similar situations from your countries. But what is important is that because of these measures, we had to adjust our qualitative approaches, and we had to make a compromise with ourselves and with our project plans that we will use more rapid qualitative research and participatory approaches with spatial distance. But are technology-based interactions with vulnerable populations such as Roma people, migrants, religious groups, LGBT, and so on, which are in our focus, feasible and possible? Do they lack depth? How will overburdened health professionals respond? Will they at all be willing to talk to us? Will they make time for an online interview, even if we get approved from a national ethic committees? We are still now in the phase that we are waiting for the approval of our national ethic committees to go on and proceed with our interviews. So for social science research, little physical contact is allowed in communities with confirmed cases. For qualitative research, this means that researchers cannot conduct face-to-face interviews, cannot do fieldworks, and they cannot collect documents except those accessible online. For some time in Slovenia, it was so. We were totally closed, and we had a curfew for more than 170 days. It stopped last month. So from October till last month, we were closed at night and, well, doing our work from home mostly. Fortunately, qualitative research does not require too many participants, and this fact makes it efficient and effective. Qualitative researchers just have to recruit participants for their study, select carefully the participants who can provide the most important and most needed data to address the problem under exploration. But it is easier said than done. Technology is now available to collect data without having to meet anyone physically. Social media have plenty of data that can be used as primary data. Plenty of video conferencing tools that can be used freely to conduct virtual interviews are available for free. The availability and integration of ICTs in the course of the qualitative research project is vast and quite comprehensive. In addition, more and more tools promote and allow to explore collaborative work, the involvement of other researchers in the different phases of a project, enabling work in multidisciplinary and international groups. There are already well-established medical and government guidelines to prevent COVID, as well as guidelines to prevent and deal with the related stress. The pandemic has not blocked research completely. In fact, although it has certainly created some methodological challenges, it has also opened up a number of opportunities. In our project, we plan to conduct in-depth remote interviews in most cases with hospital health managers, other health professionals, and patients. We expect to get important information on ethical issues raised by the phenomenon of social diversity in healthcare. Medical staff will be recruited on the basis of information provided by healthcare facilities in advance. So last year in summer, this is our luck actually. As well, we will contact them individually because three partners. We are from medical faculties, so we know some doctors, and I hope they will be willing to participate. But patients will be recruited through various associations and NGOs, such as LGBT, then the Roma Association, then Syndicate for Migrants, and so on. And according to the methodological principle of snowballing, so everybody knows somebody who could tell you more about this topic. Only participants who are able to give consent will be included in the study, and participation, of course, is voluntary. We are optimistic and we look forward to new challenges in research methodologies. So we still plan to stick to what we wrote in the proposal of our project, and we hope that people will respond to our invitation to participate with remote interviews. So this is all what I prepared. I hope I wasn't too long. Thank you very much for your attention. Donatella, we can't hear you.
What's happening?
It's okay now. We can hear you now.
Okay. Okay. So can you hear me right now? Yes.
Yeah.
Okay, I'll just give you the floor to Javier that's going to keep track to question and answer from our public. I really thank you, the panelists, for such rich presentations. I hope that we'll have a chance actually to go back to some of the points, some of the issues that were raised. Well, I do have just a question before actually giving the floor to Javier. And my question is actually, okay, for sure, we are not obliged, our projects are not obliged to be also practical projects. However, for instance, from Javier's presentation, it comes out clearly that the municipality could probably use part of this material. So my question is the municipality going to actually to make use of your material? And the same question I do have also for Laura's and Marie's project. Working with the children, especially in Laura's case in Naples, is the municipality in any event going to actually ask you to support implementing project with children for this community actually to be recognized and to be part of some of your project? And so actually this question can be probably raised also for our last presentation, and it's a general question. So how do we pose basically our HERA projects, even in a pandemic era, at the side of the public, at the side of the municipality or whatever public spheres we have in mind? Do we think that also they can make use of it somehow? And so once the project is over, are we going to pursue this possibility in order actually to make our project blossom? So that's my general question. And with this question, I really thank you for being here with us today. Javier, all yours.
Thank you, Donatella, and thanks to all of you. It's been, I think, a very interesting different views of the same topic, of the different uses of public space in the light of the COVID restrictions. And regarding to Donatella's question, this kind of practicality and how can we disseminate the knowledge that we have building, we are working with the Barcelona City Council, and it was. I think I would like to talk about, because I don't like to talk about this idea of a crisis means an opportunity, because I know that this COVID-19 crisis has brought loads of pain for so many people, and it has created really hard times for so many people. This is on the one hand. On the other hand, for the specific readaptation, this creative readaptation that we have done in the Barcelona team of FaceSpace, I think that the project has gone more deep after the changes, and then we are now have a better understanding of festivities in Barcelona, and we have a better knowledge we know each other better, specifically with the agents of Barcelona City Council or different stakeholders who organize different types of festivities in Barcelona. And so trying to answer to your question, Donatella, and try to open the floor to the other participants. I think it has some pros. And one of these pros is this sort of relationship in FaceSpace Barcelona case with Barcelona municipality and all of their agents in two different aspects. The first aspect would be this, we could access to their data, we could access to lots of documents which are not normally accessible to general public. This is on the one hand, on the construction of the database, but on the other hand, on the knowledge transference issue, we are having lots of conversations, and we're going to have different types of activities to disseminate our knowledge to a different type of audience that this sort of academic doesn't. We're very happy about that, and we're craving to do that. So I would like to introduce this little bit of optimism. I know that this has been quite a hard crisis, but I think that there are some sort of reactions that can make us see a little bit of light in the future, and I would like to stay with that. I have to say one thing. We're finishing at 4. I have to leave at 4, so this is going to be closed at 4. And just for everybody to know, and I would like to give the floor to, I don't know, whoever who wants to answer to this question that Donatella proposed.
I feel compelled, like by Donatella's question, and I think that we deal with a broader institutional environment. I mean, the municipality is not the main interlocutor of this kind of projects, even because for financial instability of local governments in Italy, especially in the south. So dealing with this kind of projects with the school in the outskirts, it's something that we do, not just cooperating with the municipality. Formally, the municipality of Napoli is a partner of our project also. But we are also experimenting more sensible ties with a broader, as I said, institutional environment. We're not just working with schools, we are working with NGOs and humanitarian organizations also, because the governance field is broader than the actual formal local government. And so we are resorting to all kinds of relationships in order to do a thing that we really care about as engaged researchers, which is giving back to the community of informants, of groups and people that we are working with. And so one of the things that we are just developing within the HERA framework is to actually implement new kinds of projects with private or public foundations in order to get fundings, to get some things done in these neighborhoods as a contribution that we might give as designers and architects and planners to these people. So I would say that one of the interesting things that the HERA project has given us as an opportunity is to actually become part of something, become part of an institutional environment. We are the university, we are a state university, but we are collaborating with lots of different agents on the field. And usually the formal government is kind of a remote, in the general framework of our work.
Okay, I can also add something to this. How can we contribute to our community in this general sense was a question that Donatella asked. So I can say that with our project, we want to deepen the awareness and experience of discrimination and access to healthcare, because we are very well aware that obviously European Union legislation and national legislations with some minor not covering ups are one thing. So on normative level, everything seems fine. It could be even better, but it seems fine. But when we come to practice, when we come to clinical practice, then the vulnerable groups, of course, face several discriminations, inappropriate attitude, maybe in words, in curiosity of medical staff, for instance, transgender persons, and so on. So on one hand, we want to deepen this awareness that the discrimination exists and that it exists through language, through our gestures, through mimics and so on. And of course, to make people more sensitive that it shouldn't be so, that there are ways that these people could be treated equally and without being discriminated. So this is our main focus, what we want to pull out from the interviews with medical staff and from the interviews with vulnerable groups. And of course, then when we have all that, we want to go wider and spread the word about it, that it's not okay, that everybody should be allowed to have equal access to healthcare. And so we are proceeding in this direction. So this is what I wanted to add.
Yes, maybe James, do you wanna comment briefly?
No, nothing to add on this particular theme. Thank you, Xavier.
Okay, does anybody else want to comment this particular issue? Giovanna, I can see your hand raised. Thank you.
Thank you. I have a question for you, Xavier, about your archive and about the items you are collecting. Are public or private? And the second is, or both. And is this archive accessible to anyone who wants to provide, to contribute with images? And you're collecting visual, but also audio, maybe. So what kind of typology of items you are collecting for your work? Thank you.
Yes, thank you, Giovanna. Look, yeah, the archive work is conducted in one particular case, which is La Merced, which is this huge festivity happening once a year from at least 150 years ago, the same particular time, and regarding to the same particular mythical reference. Nowadays, it has been reconstructed, and nowadays it celebrates like the citizenship of Barcelona. It had a big boom when the democracy arrived in Barcelona in the last years of the 70s, and since then it has grown and grown and grown. One of the elements that constitute this festivity from its beginnings till nowadays is the opening speech. The opening speech is always done by somebody who has some sort of authority, and it is chosen by the mayor of the city. So it has these political links also. We were very surprised to see that all these documents, all these opening speeches were not available to the community, to the Barcelona citizenship. They were only available from the late 90s till nowadays. They were very difficult to find, and we thought that we could find all of them from public archives. So that's where we began our research. But we were very surprised to see that not all of them were possible to find in these public archives. So that's why this special collaboration with the City Council has got us in contact with the internal archives of the City Council, and particular workers, archivers of the City Council have found these difficult texts for us. So we have not got access to this particular private archives. We got in touch with the City Council and they looked the documents for us. And that was very surprising to see. And regarding the visual and the audio type of format, we have found it's text from the end of the 90s till nowadays. Some of them are recorded also in audio, and we want to play, because it's different what you say that what you have written in order to say what you want to say, and it's very different. And from the late 2000 till nowadays, there is also a video recording. So we have these three different types of formats.
Thank you. Thank you. Very interesting as a project.
Yeah. Guys, does anybody have another question, or does anybody wants to conclude with some final remarks? We have 15 minutes to finish. Mm-hmm.
Can I just say a few words? And it's since we got here compelled by one question. So is COVID changing the way you do it and how you do it? And I mean, as far as I understand from your work, and I'm happy to say that this is the very first time that I confront my work with the work of other teams in the HERA network. And these occasions should come up more often, because I'm sure that this is a terrific network of people and dealing with really interesting things all around Europe. So, I mean, at the end of the day, at the end of this meeting, I would say that we didn't really change our methodology because the very idea of change is something that goes with also the idea that the pandemic is something, that, just there's a before and there's an after. I think that methodologically speaking, we are all through a big transition. The pandemic, unfortunately, is here to stay. It's not something that it's gonna disappear overnight. And I feel like we kind of expanded our methodological thinking and also resorting to other means and tools, and also, inventing new things. It's like, somebody changes the categories, other are thinking about their tools, others are thinking about the typologies. But mostly, I mean, we are actually expanding the level of collaboration with other researchers, with other interlocutors. And so I feel like in this field that we live in differently, of course, which is the humanities with different nuances. I'm a planner, she's an anthropologist. So we are really, she's a medical doctor. So we are really a different bunch of people. But the interesting thing, I mean, at the end of this meeting to me is that we kind of augmented our field of interests and practices. And I use the term augmented because, of course, we are resorting to all kinds of digital things. And, but it's not, I mean, sometimes this kind of digital things can be really sophisticated, as in James' case, right? But in other cases, we just use phones, and WhatsApp and apps and very daily kind of things that we use to stay connected, to keep nurturing the ties of trust that somebody was talking about at the beginning of this meeting, which I think it's crucial for everybody who does any kind of field research. I mean, you do the hell of your best because you need to build trust with your informants and with the people. And so it's interesting because all sorts of daily objects are becoming part of our, kind of work table. So I learned a lot today, although, I mean, I go away with much curiosity because, of course, I didn't get the whole thing from all of you, but I wanted to thank you so much because I feel that I belong in a way to some kind of outer community, which is the HERA community. And it's a good feeling. Thank you.
Thank you, Laura. I really like the idea that you just posed about we are in a transition period, and I think that this is a big truth. I think James wants to add something.
Yeah, just very quickly to follow up on Laura's point there about the more sort of daily forms of communication. One thing that we've noticed sort of within our own project, which combines academics from the University of Sheffield, Utrecht, Oldenburg and Stockholm, is that our project communications have actually improved dramatically since the pandemic. I know sort of originally we were sort of trying to have these chats, it was Skype that we were using at the time, which, because it's owned by Microsoft, is an absolutely atrocious piece of software. And it was such a nightmare. And it was like, oh God, we've got to have a Skype today. Whereas now the sort of the routinization of things like sort of Zoom have meant that just day-to-day, week-to-week sort of project communications and meetings have become sort of much easier than they ever were before.
Yeah, sure. Does anybody else want to add something? Otherwise, I would close this meeting. I would like also to say that it's been a pleasure to meet you. It is also my first time here in this sort of HERA webinars, and I do think that this is a really good activity, and it is very good to. It's been very, very, very interesting to listen to your presentations. Making time if somebody wants to speak. If it is not the case, I would like to thank all of you, all the speakers, also people who probably watching us through internet, and the organizers. And Rosemary, I'm gonna give the floor to you. Thank you very much to all of you.
Thanks, Xavi. And yeah, just to echo those thanks to everybody for participating in our discussion today. It was very interesting to hear how everyone's so dynamic in their responses to this pandemic, and also James's point about the connectivity and the communication, how it has strengthened through this pandemic. I think we can all agree that Zoom has helped. But just, yeah, a massive thank you to everybody. It was a wonderful afternoon. Just to publicize our next webinar, which is going to be titled Mobilities, Migrants and Minorities in Dialogue. It's happening on June the 8th at the same time. It will be open to register in the next day or two. So you can register through the HERA website and Eventbrite itself. So you're so welcome. There's another 3 HERA projects represented to that, and we look forward to seeing you all again soon. Hopefully our webinar series will turn into our physical meeting at the next conference. So thanks again to everybody. Goodbye.